the client from side to side, literally right and left side. For the purpose, movement to the literally side laying position may be necessary when placing bed fan freely the client, when changing bed line, or when reporting the client. For the implementation, a sensitive device that will be required friction reducing device or mechanical lift. Limitation to movement such as an IV on an indwelling urinary cartridge. For the preparation, prior to perform the procedure, introduce yourself and verify the client identity using agency protocol. Explain to the client what are you going to do, why it is necessary, and how to participate. Good morning, Ma'am. I'm Kimberly Wanas, and I will be your nursing student for today. For the second, perform the hand hygiene and observe other appropriately infection prevention procedures. Then after that, provide the client a privacy.
Next, position yourself and the client appropriately and comfortably before performing the move. And if there are any other individuals, we have to make sure that they will stand on the opposite side of the bed. And we will now adjust the head of the bed in a flat position or for as low as the client can tolerate. The rationale behind this is that this provides a position of comfort for the client. And we will raise the bed appropriately for personal safety. Next is we will lock the wheels on the bed and we will move the client closer to the side of the bed on the opposite side where the client will face when turned. The rationale behind this is that this ensures that the client will be positioned safely in the center of the bed after the turn. And we can also use a friction reducing device or mechanical lift to pull the client on the side of the bed. And next is we will adjust the client's head and we will reposition the legs appropriately. So when we are standing on the side of the bed nearest the client, we will place the client's near arm across the chest and we will abduct the client's far shoulder from the side of the body and externally rotate it. So the rationale behind this is that pulling one arm forward facilitates the turning motion and pulling the other arm away from the body and externally rotating the shoulder prevents the arm from being caught beneath the client's body during the roll. Next is we will now place the client's near foot and ankle across the far foot and ankle. And the rationale behind this is that this facilitates the turning motion and making this preparation on the side of the bed closest to the client helps to prevent the unnecessary reaching. And the individual on the opposite side of the bed towards the client will turn should be positioned directly in line with the client's waistline and as close to the bed as possible.
In turning the client to a lateral position, the second individual should stand on the opposite side of the bed, helps roll the client to the other side. Now, place one hand on the client's far shoulder and the other hand on the client's far hip. The rationale for this is this position of your hands support the client at the two heaviest parts of the body, providing greater control in movement during the roll. Now, position the client on his or her side with legs and arms positioned and supported properly. Lateral positions with pillows in place. Okay, let's start. I'm going to do a lateral position, both sides for the right and left. Is that okay with you? Okay. Okay, now providing the pillow. Let's start with it on the back of the client. And the upper feet should be quite ahead of the lower feet. The arms. We also provide a hand roller to prevent strain. To the left side, here I'm going to do the left lateral position. Putting the pillows at the back. In turning the client into a prone position, you need to follow these preceding steps with 2 exemptions. Okay, instead of abducting the client's forearm, keeping the client's arm alongside the body supports the client when it is low. The rationale for this is keeping the client's arm alongside the body prevents it from being pinned under the client when the client is low. Now, place the client completely under the abdomen. The rationale for this is essential to move the client as close as possible to the edge of the bed so that the client will be lying at the center of the bed. Also, never pull the client across the bed while the client is in a prone position. The rationale for this is by doing this can injure the female's breast and the male's genital. Okay, sir, I'm going to do a prone position. Is that okay? Tell me po if there is discomfort po. Lastly, document all refer information. Record the time and change of position, move from, and position move to. Okay? For your record po, for the right lateral positioning, it costs 1 minute and 30 seconds. And for the left lateral positioning, it takes 55 seconds. And from the prone positioning po, we could state in this record it was 1 minute po. Now for any signs of pressure area and use of supported device, because my client doesn't use supported device, so we don't include any redness or inflammation. We didn't check any redness or inflammation. And the ability of the client to assist in moving and turning. As you can see in the demo, the client had the ability to assist in moving and turning. And for the response of the client in moving and turning, the client didn't state or say anything regarding any discomfort or awkwardness during the demo.
So next is the lag rolling of a client. Starting off with the purpose, lag rolling is a technique used to turn a client whose body must at all times be kept in straight alignment or like a log. An example of this is if our client have a back surgery or have a spinal injury, considerable care must be taken to prevent any additional injury. Furthermore, this technique also requires 2 nurses, or if our patient is large, we might need 3 nurses. So for the client who has a cervical injury, 1 nurse must maintain the client's head and also the neck alignment. Moving on to the implementation, first for our preparation, we need to determine all the assistive devices that will be required, the limitations to movement such as an IV or a urinary catheter. We also need to determine the medications the client is receiving, because certain medications may hamper movement or alertness of our client. We also need to determine the assistance required of our client and other healthcare personnel. At least 2 to 3 additional people are needed to perform this technique or skill safely. So next for our performance, prior to the procedure, first is we need to introduce ourselves and verify the client's identity using the agency protocol. We also need to explain to our client what are we going to do, why is it necessary, and how will she participate. So, good morning, ma'am. I am Casey Ascorial and I will be your student nurse for today. I will just confirm your information, ma'am. Is that okay? So, you are Eliza Joy Bustos, 19 years old. Your birthday is on March 10, 2001, and you live in Sindalan City of San Fernando, Pampanga.
Yes, it is
Okay,
correct.
ma'am. Thank you. So next is we need to also perform hand hygiene and observe other appropriate infection prevention procedure. So now I will just perform alcohol-based hand rub since my hands are not visibly soiled and dirty. Okay. So next is we also need to close all the doors as well as the window to further provide for our client's privacy.
Position yourself and the client appropriately before the move. So place the client's arms across the chest. So ma'am, can you please cross your arms? Doing so ensures that they will not be injured or become trapped under the body when the body is turned. Next, pull the client to the other side of the bed. Use a friction reducing device to facilitate leg rolling. First, stand with another nurse on the same side of the bed. Assume a broad stance with one foot forward and grasp the rolled edge of the friction reducing device. On a signal, pull the client towards both of you. One nurse count 1 to 3. Then at the same time, all staff members pull the client to the other side of the bed by shifting their weight to the back foot. Moving the client in unison maintains the client's body alignment. One nurse moves to the other side of the bed and places supporting devices for the client when turned. So place a pillow where it supports the client's head after the turn. Okay, ma'am, I will now put pillow under your head. The pillow prevents lateral flexion of the neck and ensures alignment of the cervical spine. Place 1 or 2 pillows between the client's legs to support the upper leg when the client is turned. This pillow prevents adduction of the upper leg and keeps the leg parallel and aligned.
Next, we need to position ourselves and the client appropriately when doing the move. The first thing that I will need to do is I need to position the client in a lateral position that is facing me, and I can use assistive devices if it is necessary since this will ensure the client's safety. Sir, I'll now move you into a lateral position. I'll assist you and you need to face me, okay? I'll count up to 3. 1, 2, 3. Okay, so after that, we need to raise the head of the bed into its highest position because this will decrease the distance that the client needs to move when moving into a sitting position. So let's just assume that I already lifted the head of the bed into its highest position since I cannot do that since this is not a mechanical bed. So the next thing that I need to do is I need to place the client's feet and the client's lower legs towards the edge of the bed since this will allow the client to move easily into a sitting position, and the client will be aided by gravity into a sitting position. Okay, so after that, I need to stand beside the client's hips and face the bottom far corner of the bed, and I will assume a broad stance. I need to place the feet that is near to the client's hips and the head of the bed forward, and I need to lean my trunk, my hips, and I need to flex my knees, my hips, and my ankles.
Now we are going to move the client to a sitting position. Keep in mind that we have to use assistive devices depending on the client's assistive needs. So the first thing that we have to do is we have to place the arm nearest to the bed under the client's shoulder and the other arm over both of the client's thigh near the knees. And the rationale for this is supporting the client's shoulders prevents the clients from falling backward during the movement. And supporting the client's thighs reduces friction of the thighs against the bed surface during the move, and it increases the force of the movement. Then we have to tighten our glutes, our abdominal leg, and our arm muscles. And then we are going to pivot the balls of our feet in the desired direction, facing the foot of the bed while pulling the client's feet and legs off the bed. And the rationale for this is pivoting prevents twisting of the nurse's spine, and the weight of the client's leg swinging downward increases downward movement of the lower body, and at the same time it helps make the client's upper body vertical. Okay, ma'am, so I'm going to pull off your legs and thighs and so that we can have you seated. Would that be okay with you, ma'am? Okay, so let's start. Now we have to keep supporting the client until the client is well balanced and comfortable. And the rationale for this is the movement may cause the client to feel lightheaded or dizzy. Okay, so since the client is already comfortable, we can now proceed to the last part, which is we are going to assess her vital signs as indicated by the client's health status. So to start off, we are going to assess her pulse. Okay, ma'am, so I'm going to check first your pulse. So please relax. Okay, ma'am, so your pulse is normal. So next, we are going to proceed with the respiration. Okay, ma'am. Okay, so your respirations, ma'am, are also normal. And lastly, we are going to check for your blood pressure. So same as your pulse and your respiration, your blood pressure is also normal.
Now you're going to document all relevant information. Record the ability of the client to assist in moving and turning. Record the type of assistive device, if one was used. Record the response of the client to moving and turning. Example of this is the anxiety, discomfort, or dizziness. Now for the evaluation. You must check the skin integrity of the pressure areas from the previous position. Relate findings to previous assessment data, if available. Conduct follow-up assessment for previous and new skin breakdown areas. Check for proper alignment after the position change. Do a visual check and ask the client for a comfort assessment. Determine that all required safety precautions, example is the side rails, are in place. Determine client's tolerance of the activity, vital signs before and after dangling, particularly the first time the client changes position. Report significant changes to the primary care. Note: this skill describes the process to use for a client who is able to perform the task independently and only needs standby assistance for steadying, or a client who requires minimum assistance, in which the client can perform the task with or without reducing assistive devices. And the healthcare worker provides 25% of the work for clients who require moderate assistance, requiring no more than 50% assistance by the caregiver, or maximum assistance, requiring more than 50% assistance by the caregiver. A lateral chair or mobile or ceiling-mounted transfer system is required.
Good day, I am James Lewis Gomez, your student nurse for today, and now we will conduct assisting client in ambulation. So, for the purpose of this is to provide a safe condition for the client to walk with whatever support is needed. So, for the assessment, the first thing we need to do is to assess the length of time in bed and the amount and the type of activity the client was last able to tolerate. So, of course, baseline vital signs, range of motion of joints needed for ambulating. Example, hips, knees, and ankles. And for the next one, muscle strength of lower extremities and need for ambulation aids. Example of this is cane, walker, crutches, lift with ambulation sling. So, clients intake of medication. For the example of this is opioids, sedatives, tranquilizers, and antihistamine that may cause drowsiness, dizziness, weakness, and orthostatic hypotension. Seriously hindering the client's ability to walk safely. So, presence of joint, inflammation, fractures, muscle weakness, or other conditions that impair physically mobility. So, also ability to understand direction, level of comfort, and lastly, weight-bearing status. So, after that, let's proceed for the planning. So, for the planning, implement pain relief measures so that they are effective. The amount of assistance needed while ambulating will depend on the client condition. So for the example, of course, we have age, health status, length of inactivity, and emotional readiness. So review any previous experience with ambulation and the success of such efforts. Let's plan the length of the walk with the dentist, considering the nursing or primary care practitioners are orders and the medical conditions of the client. So at least be prepared to shorten the walk according to the client activity tolerance. So after that, let's proceed for the assignment. So ambulation of clients is frequently assigned to AP. However, the nurse should conduct an initial assessment of the client's abilities in order to direct other personnel in providing appropriate assistance. Any unusual events that result from assisting the client in the ambulation must be validated and interpreted by the nurse, of course. So for the equipment needed, assistive devices required for the safe ambulation of clients. For example, we have transfer belt, walker, cane, sit to stand assist device, and lift with ambulation sling. So also we have wheelchair for the following client, or chairs along the route if the client needs to rest, and lastly, portable oxygen tank if the client needs it.
So for preparation, we have to be certain, or we have to ensure that others are available to assist us if needed. And also, we should also make sure that, or we have to plan a route for ambulation that has the fewest hazards, or a clear path for the ambulation. So prior to the performance or prior to the procedure, we have to introduce ourselves to the patient and also clarify or verify the client's identity. So good morning, ma'am. My name is Vivian Lee. I'll be your student nurse for today. Before we start, ma'am, I just want to clarify or verify your information first. So your name is Miss Lee. Okay, ma'am. So what I'm going to do is, ma'am, I'm going to assist you in ambulation. Before we start, I'm going to perform hand hygiene. Excuse me. This is to prevent any spread of microorganisms or infection to the patient and also the nurse. So before we start, I'm just going to check if you are fully dressed or you have any non-slip slippers. So let us assume that Miss Lei is already fully dressed with non-slip slippers. So, ma'am, can you please stand up on the bed if it's okay? I'll just assist you. Okay, ma'am, thank you. So, as you can see, ma'am, Lei has already stood up. So, we have to wait for a minute This is like the preparation for the next step, which is dangling of the legs at the side of the bed. Okay, so a minute has passed. Ma'am, can you please dangle your legs to the side of the bed? I'll just help you, ma'am, if it's okay. Thank you, ma'am. So what we're going to do is we're going to wait for another minute. So let us assume that Ma'am Lay has her legs dangling at the side for a minute. So the next step is we're going to assess or observe if Ma'am Lay has any signs or symptoms of hypotension or any dizziness, lightheadedness, and also any sudden change of a heart rate prior to the next procedure. So like the rationale for this is to allow any gradual adjustment that can minimize any drops of blood pressure. That occurs with shifts of position from lying to sitting and sitting to standing. So the next step is we're going to assist Ma'am Lay in standing for at least a minute as well. And this is until she feels secured. So ma'am, I'll help you with standing up. Can you please put your hands over my shoulders? And I'm going to... Oops. Are you okay, ma'am? Okay, let us assume that Miss Lay has been standing up for at least a minute or more. Then the next step is we're going to attend or carefully attend any IV tubings, catheters, and also drainage bag. So let us assume that this is a drainage bag. And also what we need to do is we have to keep this urinary drainage bag below the level of the client's bladder. And the rationale for this is to prevent any backflow of the urine into the bladder and also risk of any infections. So I'll just put this on the other side. So let us assume that was a drainage bag. So for example, if a patient is with a high safety risk or which someone who cannot follow commands, he or she is medically unstable or has an instability or any lack of experience with assistive devices, we're going to use a lift with ambulation sling, or we have to have assistants, or which are 1 to 2 caregivers. And for example, if a patient is a high safety risk as well but has an upper extremity strength and is able to grasp at least with one hand, we have to use a lift with an ambulation sling or a sit-to-stand lift with an ambulation capability and 1 to 2 caregivers or assistants. So for example, if a client is a low safety risk, which someone who is able to follow commands, he or she is medically stable and has experience with assistive devices, lay here, we're going to use a gate or transfer belt for any standby assist as needed and assistive devices as needed, like crutches and also walkers, and 1 to 2 assistants or caregivers. So let us assume that this is a transfer belt or gate belt. What we're going to do is we're going to put this snugly on the patient's or Ma'am Lay's waist securely. So okay, so it is secure on Ma'am Lay's waist, and we have to fasten it securely like so. Then the next thing is we're gonna prepare for the client for the ambulation. So what we're going to do, ma'am, can you please look at the side or turn yourself at the side? The next thing that we're going to do is we're going to grasp the belt at the client's back and walk behind and slightly walk behind the client and slightly to one side of the client. Support the client when walking during the ambulation. So, ma'am, let us walk over there. I'm just gonna support you.
So now, let's proceed to ensure the safety of the client by assisting or transferring her to ambulate. So, encourage the client to ambulate independently if she or he able to walk beside the client to walk side. If appropriate, the client has lightweight for hold because of infusing fluids. He or she may find that holding onto the pole while ambulating helps with balance. So, if the pole or other equipment is cumbersome in any way, the nurse must push it match the client's pace, securing any assistance necessary in order to move smoothly with the client. So now, remain physically close with the client in case of assistance is needed in any point. So make sure that your right hand is holding the side of the patient or the client to ensure the safety of the client. So if the client's first time out of the bed following surgery, injury, or any extended period of immobility, or if the client is weak or unstable, have assistant follow you, and client with the wheelchair in the event of the needed quickly. So, ma'am, you have any past surgery or injury? Okay, so now let's encourage the client to assume a normal walking stance and gait as much as possible. Ask the client to straighten the back and raise the head so that the eyes are looking forward in a normal horizontal plane. So the rationale of this is clients who are unsure of their ability to ambulate tend to look down at their feet, which makes them more likely to. So, ma'am, I want you to walk. Okay?
Next is we have to protect the client who begins to fall while ambulating. If a client begins to experience the signs or symptoms of orthostatic hypotension or extreme weakness, quickly assist the client into nearby wheelchair or other chair and help the client to lower the head between the knees. Now, may I ask you to sit, please? And then I ask you to put your head in between your knees. And then the next thing that we have to do is to stay with the client. The rationale for this is that a client who faints while in this position could fall their head first out of the chair. And then when the weakness subsides, we have to assist the client back to the bed. Ma'am, you may lie under your bed again. Never catch a falling client. A caregiver probably cannot stop a client from falling. Also quickly remove the obstacles out of the way that may injure the client. Also do not manually lift the client from the floor. Use SPHM technology. And then for variation, we'll be needing 2 nurses on that one. And first is place a gate or transfer belt around the waist of the client, and then each nurse will grasp the side of the handle with the near hand and then the lower aspect of the client's upper arm with the other hand, and then the nurses have to walk the client in unison also with the client and using a smooth or even gait at the same speed and also the same steps and the same size as the client. Next thing that we have to do is to document the distance and duration of ambulation and assistive devices if we have used any, and the client record using the forms checklist supplemented by narrative notes when appropriate. Also, we have to include the descriptive of the client's gait, including the body's alignment when walking pace, and also the activity tolerance when walking. Example of this are the pulse rate, facial color, any shortness of breath, feelings of dizziness or weakness if there are any, also degree of support required, and respiratory rate and blood pressure after the initial ambulation. This is to compare the baseline data. Also, for the evaluation, we have to establish a plan and for continued ambulation based on expected or normal ability for the client.
The purpose of the body mechanics. Body mechanics is the use of the safest and most efficient methods of moving and lifting. This means applying mechanical principles of movement to the human body. Nurses often need to teach clients the use of proper body mechanism for safe walking and movement to prevent further injuries. We will now proceed to the principle of the body mechanics. First is the center of gravity. A person's center of gravity is located in the pelvic area. When lifting an object, bend at the knees and hips and keep the back straight. By doing so, the center of gravity remains over the feet, giving extra stability, and it is thus easier to maintain balance. So the next principle is the base of support. A person's feet provide the base of support. The wider the base of support, the more stable the object within limits. The feet must not be too wide apart, as this would cause instability. The feet are spread sidewise when the client is lifting something to give side-to-side stability. Last is the line of gravity. The gravitational plane is the line through the top of the head, the center of gravity, and the base support. For higher efficiency, this line should be straight from the top of the head to the base of support, with equal weight on each side. Therefore, if a person stands with the back straight and the head erect, the line of gravity will be approximately through the center of the body, and proper body mechanics will be in place.
Assessment. Prior to the procedure, we're going to assess for the following. We're going to assess the environment for any obstacle that may affect the procedure. Then we're going to assess the weight or the load before lifting and determine if assistance is needed. This is to request assistance beforehand. Then we're going to plan the move to execute the procedure efficiently, then ensure proper body mechanics to avoid injury. Planning. We're going to plan the move and determine what lifting techniques using good body mechanics will be used. Then we're going to determine if assistance is needed, as well as how many assistants will be needed.
Position body close to object, straddle your legs, use leg power. If the object is heavy, ask for help. Widen your base of support and bend your knees. Tighten your stomach muscle and lift your leg muscle. Keep your load close to your body. Keep your back straight.